So I am really excited to bring to you two of my favorite people. And they're not just my favorite people because I love them as human beings, but they have a really cool message around some biohacking equipment that I really want to bring to everybody's attention, especially at this time when we're dealing with people really focused on their immune systems. So let me start off by just welcoming Dr. Jason and Dr. Melissa Saunders to my platform. Thank you guys for being here.
Thanks for having us, Mindy.
Thank you, Mindy. You know, we adore you too. It's been too long. It's
too
long
has been too long. I know. I feel like Zoom has now become like my new touch point, and it's really hard because I'm a touchy person, and I just want to like grab the computer and give you guys a hug. So, but you know, why we have you here is you guys are doing some really cool things in the world, and I know that Jason's written a great book, and I want to start off with this idea that there are some really cool biohacks that we can be doing right now, not only to keep our immune system up, but also I shared with you guys earlier that I was on a YouTube Live this morning, and people are concerned that actually have the virus. They're concerned about what to do. So can we start off by let's talk about hyperbaric specifically, because I know, Jason, you have a book on this. Let's start off by what is hyperbaric oxygen and how can it benefit our immune system?
Okay, sure, yeah. So hyperbaric is just that, hyper increased baric pressure. So, you know, it means a lot of things to a lot of different people. There's, you know, different equipment that, you know, create different amounts of pressure and offer different amounts of oxygen. So to some people, they hear the word hyperbaric, they think of, you know, a big room that multiple people go in. Some people think of those like clear glass tubes in a hospital. Some people have, you know, soft chambers. So there's a lot of different equipment, and it's all really called the same term, but the different types of equipment offer a similar therapy, but you know, it's really about matching the right therapy to the right person with the right, you know, condition or need. So and any of those cases, we're increasing pressure and we're increasing oxygen levels as a way to increase the amount of oxygen that a person can absorb. That's kind of like the most simplest of terms, I think.
Yep.
Go ahead.
Yeah, go ahead, Melissa. What would you add to that?
Yeah, I was just going to say one of the things that we use to explain it too is we really look at oxygen as a nutrient. Right. And so just like any nutrients that we need access to at certain times in the season, or if we're dealing with certain viruses or bacteria or boosting our immune system, oxygen is a really, really powerful nutrient. And so if you want to get more of it, the only way you can really absorb more is if you pressurize it. And so that's what hyperbaric oxygen does. It's one of the only tools that can actually get more oxygen in by pressurizing it.
Yeah. And I think I learned that from you guys. You know, I was when I first started seeing the effects exercise could have on things like cancer, we all got into HIIT training, right? And you tend to think you're driving more. The theory was you were driving more oxygen into the lungs by doing these intense workouts and into the body. But what I learned from you guys and my evolution of thinking with oxygen is that it doesn't matter how much you drive into your body, it's how much is getting into your cells. And that's where you have to compress it. Is that correct?
Yeah. I mean, if you exercise, your heart rate goes up, your respiratory rate goes up. So you're breathing more, your heart is pumping more. So you're creating like a shift in the supply and demand of oxygen. So you are, even in those scenarios, you are increasing oxygen. But if you know the pulse oximeter, the little thing they put on your finger when you go to the doc or you're in the hospital, you know, even when you're exercising, or HBOT is another exercise while with oxygen therapy, you know, those are tools to shift the supply and demand of oxygen, which definitely improve the oxygen delivery, but you're still relying in all of those scenarios, you're still relying completely on red blood cells, which is the normal way we carry oxygen in our body. In order to get oxygenated beyond the amount that a red blood cell can carry, that's where the whole pressurized component comes in. And so the reason we absorb oxygen at any time is because we live in an atmosphere. The atmosphere has a pressure, and that pressure creates a gradient, and gases move from high concentration to low concentration. So, you know, at sea level, there's a certain pressure, it's 14.7 PSI. As I breathe, that allows me to oxygenate my body, but I could create a higher amount of pressure. And if I have a higher amount of pressure, I could drive a higher amount of oxygen. And so that's where we could really super saturate oxygen at the levels that we're talking about.
Awesome. So let's apply it to today. Are you guys on shelter in place?
Yes.
Yeah, and so are we. So, immunity is on top of everybody's mind. And, I know you guys have a biohacking center. We have a biohacking center here in Silicon Valley. We've got hyperbaric. You guys probably have like 20 hyperbaric in your clinic.
We were just upstairs, actually. We've got one at home too. So we just had the kids in our home unit.
I love it. I love it. So let's talk about if I want to keep my immune system strong right now, which I hope and I pray is on the top of everybody's mind. Staying at home is going to make sure that we don't get exposure. But then there's this whole conversation I'm trying to get people to acknowledge, which is that then even if you're at home doesn't mean you have a strong immune system. So there are biohacks you can do like hyperbaric oxygen. So if somebody was to go into get hyperbaric oxygen right now for immune system, how is it boosting our immunity? Do we have any science on it? What do we know about that?
Mm-hmm.
So, I mean, we know a lot about that. And just to add to that point, I mean, I agree, it's one thing to take a stance to try to not expose ourselves to the virus, but in general, whether we're exposed or not, taking the time out of our life to consistently be working on making us the strongest we could possibly be, that's the critical piece. Melissa and I talk about adaptation all the time. Our world is changing every day. And this is just one massive example of that, but it's not the last massive example of that.
No.
And so it's not just in this moment, but it's in this moment, if you haven't already, it's this moment going forward where, we need to be creating plans in our lives, or as healthcare providers, helping patients create plans in their lives of what can we be doing on whatever regular basis to continue, not just right now, but to continue ongoing, rebuild my immune system, rebuild the integrity of my body so that I can continue to adapt regardless of, all the different changes that are going on out there. So, and hyperbaric just plays a role as one of those. I mean, like you said, we have a whole clinic that, we utilize all different types of therapies and equipment, and whether that's hands-on or supplements or modalities. So, and they're all, not all of them, but, they're, for the most part, the things you use in your room, the things we use in our clinic, those are all great tools for really improving that immunity and that ability to adapt. So hyperbaric is, like I said, it's this tool that's creating this increased oxygenation in our body. Like Melissa was saying, it's a nutrient. So, so much of our disease or disease or whatever the issues that we're having is toxicity. Or do we have too much of something that we need to get rid of, or do we not have enough of something that we need more of, a raw material to allow our body to do what it does? And so in so many cases, using oxygen as a nutrient type of analogy, there are times where you want to mega dose oxygen as a tool to allow oxygen to do everything it does in our body. And there are just so many things that it does. Specifically, when we talk about the immune system, there's a handful. One, it gives our cells the energy that they need to perform whatever their job is. So every cell, other than, red blood cells carry oxygen. Besides red blood cells, every other cell in your body needs oxygen to perform its job. So liver needs oxygen to make ketones or to detoxify. Intestinal cells need oxygen to absorb nutrients. And your immune system needs oxygen to do its job, which is fight infection. Or decrease inflammation. So, when we start putting this hyperoxygenation into the system, we see a few things happen. We see an upregulation of the immune system. We see specifically neutrophils and macrophages, which are the two of the main white blood cells that attack new infections. So it gives them the energy that they need to fight infection. It increases what's called reactive oxygen species, which is one of the ways that, again, our body uses to destroy foreign material and foreign invaders. It creates a better balance. We know, and I'm sure you talk about this in other shows, the microbiome is such a critical part of our immune system. It's such a critical part of our digestive system. It plays a much bigger role in our whole body than really we ever knew. And so one of the things that happen also as a result of hyperbaric oxygen is most of our probiotic, like the good guys that live in our body, they either love oxygen or they at least tolerate it very well, while pathogens really don't do well at all in that high oxygen environment. So, you know, what it allows us to do is it allows us to feed and create an environment where a probiotic can thrive and do really well, which will help protect us, and at the same time lower the bacterial load of some of the pathogens that might be living in us, because it helps break down biofilms, it helps destroy anaerobic bacteria. So it almost acts like a natural antibiotic from that vein too. And we know that because even in hospitals, we use hyperbaric, not we personally, but you know, we use hyperbaric for gangrene or osteomyelitis. So really terrible infections. That same way, hyperbaric could be used for more moderate or mild infections also. So I'd say that's a summary. I mean, there's a lot more detail there, but that's a summary of, you know, a handful of the places that hyperbaric plays a role in our immune system.
I love it. And we have left your book out on our, we have in our clinic, I call it our lounge when you first walk in. I don't like the concept of a waiting room, so I call it a lounge. And we've left your book on the coffee table on the lounge. And you know what's so fun is like patients are picking it up and they're telling us, they're like, hey, did you know? Did you know? And I'm like,
I love that you have that your reset room now too. You know, I think one of the big things that's going to come out of everything that's going on right now is there's going to be a huge, massive, really understanding of health is our number one value. And, you know, I think there's this mindset of traditional medicine, and thank God that we have it, because there's a time and a place. And so we can, you know, get to a point where we're sick and then we can rely on traditional medicine. But what this is really showing is like, you know, for this virus, there is not a lot that traditional medicine can do. And so it's not even a waiting game of, okay, God forbid I get it, well, I can access this. Like, really what needs to be in place is how strong can you make your immune system so that if or when you're exposed, you're in a better place. And like Jason said, this is not the first and it's not going to be the last.
Not going to be the last.
So, you know, things like your biohacking tools or what you have in the reset room, like those are really longevity tools and immune boosting tools, you know, like those are the things that are active approaches to improving our health. So, you know, there's food, there's eating things that we can do. And then there's these like passive therapeutic modalities that I think are just going to become ever so important, you know, on the other side of this.
Yeah, I can't, I have so many things I want to say on that, because I feel like we tend to think of the health part of this as being temporary, but it's not. If there's one thing that I hope people are getting in this moment, is that you could, and I'll only say what I see here in Silicon Valley. We have families where you have both parents that are working, usually, you know, high pressured, high tech jobs, that they're traveling a lot. They've got their kids in 4 and 5 different activities, and like they are on the go, 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 go. And it would be easy to come and look at that lifestyle and go, oh my God, those people have it all. They have the house, they have the cars, they have the prestigious jobs, their kids speak 4 languages. And, you know, you can look at all of that. But what I think this virus is teaching us is all of that means nothing if you don't have your health. One virus could come to town and take that all away. So what are we going to do after this? And this is where tools like this are become, like, I love when you said oxygen is a nutrient. This, in my book, becomes a mandatory piece of equipment for if you want to keep your health at its highest.
100%. And, you know, if you pull a room on their number one value, a lot of people will say things like freedom or family or financial stability. But again, just like you said, if a virus comes in, and just like we're seeing now, none of that matters. You have no freedom if you're not healthy. Financial stability doesn't matter. Family, you know, like it really all comes down to health.
Yeah, absolutely. So, okay. And then I know this is a little bit of a controversial thing, and I don't know if you guys have access to this kind of information, but there was some word that in China, when people started getting the virus, that they used hyperbaric on people who already had the virus with great success. Is that rumor? Is that true? What do we know about that?
Well, so we've seen some of that information. I mean, we don't want to speak on it from a scientific or medical point because we don't know. We can't verify that. But there is a lot of information that we can speak on in regards to hyperbaric oxygen, specifically for the mechanisms that are very similar to what we're seeing with COVID. So it's a virus, and there's an inflammatory component and a respiratory component. And hyperbaric is massively powerful with all those things. The Hyperbaric Hyperbaric Medicine International just actually put out a really good paper specifically talking about hyperbaric being used for the Spanish flu and other pandemics.
Way back then, it's in 1918. Yeah.
Yeah. So why don't,
so, I mean,
Jay, why don't you talk?
We've seen some case reports, and again, it makes a ton of sense. I mean, here's the thing. The only reason we breathe is so that we can get oxygen, basically. And the only reason we need oxygen is to feed our mitochondria so that our cells can make energy. I mean, that's virtually what this is all about. Now, any infection, besides all the things that we talked about, like the lowering inflammation, the boosting of the white blood cells, the increasing the stimulation of neutrophils and macrophages. So there's all these just general immune implications of using hyperbaric oxygen. But any time where you have like some sort of respiratory issue, it becomes a question of, are you unable to breathe, or are you breathing but unable to gas exchange? In other words, your respiration is relatively normal, but you're not getting enough oxygen flow, versus you're actually not able to even breathe. And those are different phenomena. So if you have a mechanical error with your breathing, you need like a ventilator. That's where, a mechanical ventilator would make a lot of sense. If you're able to breathe, that's not going to change your oxygen exposure. It's still going to be room air, 21% oxygen, but it's mechanically allowing your body to perform the duty that, we're trying to do on our own. If it's a question of the fact that I'm breathing, but because of various reasons, I'm not getting the right amount of gas exchange, well, then a hyperbaric chamber would be a better fit for that, because you don't need help breathing, you need help gas exchanging, and pressure creates gradient, and gradient drives diffusion. So if you can change the diffusion rate of oxygen at our lungs, then you can improve the amount of oxygen absorption. So in the cases that we saw in China and in South Korea, they're using them in these advanced cases, sometimes alone, and sometimes you could use, in hospital settings, you could be doing ventilation and hyperbaric simultaneously. So, depending on what the patient's needs are, like I started this with, different tools for different conditions for different patients, depending on their need and what the clinical outcome is. So if the issue is mechanical breathing, then we need something like a ventilator. If the issue is gas exchange, then hyperbaric plays a better role in driving that diffusion, driving that oxygen exchange, and improving the oxygenation of the tissue so that our body can sustain life.
Yeah, that's awesome. Yeah, and so would you recommend, like, if somebody doesn't have the virus, you would just add this into their immune protocols right now, just to okay. And
Definitely.
if somebody did have the virus, like we have a member in our Reset Academy right now who lives in New York, and she wasn't officially diagnosed. She did call her doctor, and she has all the classic symptoms. So we're giving her protocols right now. Would you look, and I know that you don't know the case, and we are on a public platform, and please don't take this as medical advice if you're listening. I just want to give people some examples. Would this be a scenario where hyperbaric could be helpful for her?
So yeah, it could certainly be helpful. It's just not it's not like hyperbaric is a substitute for ventilation. So like I was saying before, if you can't breathe, that's a different story. If you can breathe, but your oxygenation is low, or your gas exchange is going to be low because of compromised lung tissue, then hyperbaric could be very appropriate. So it's important to know that distinction and be able to say, okay, this is me not able to physically breathe, I need breathing support.
Right, there you go.
Versus I'm able to breathe, but I'm not getting the air that I feel like I need to get. Or some people, like if we use a pulse ox and your pulse oximeter, so your oxygenation could be low, but you feel like you're able to breathe, then hyperbaric could be a very appropriate tool. So really, yes, And it really depends. Every case is going to be different, and each patient, and knowing those particulars is really the critical piece to know, kind of which way they need to go.
Well, and also just, general information from a virus standpoint. If I were diagnosed with something that were viral and I were at all concerned and wanting to do anything that I could, and for a lot of people, viruses, most people deal with them just fine, right? So it's a matter of getting through it over time. I would 100% be jumping in our chamber. I'd be putting our kids in the chamber because, like Jason talked about at the beginning of the call, the dramatic, immune response that you can ramp up with hyperbaric. So the white blood cells, the probiotics. So all those things, when you're dealing with a virus, hyperbaric oxygen is very powerful.
Yeah. I've been getting in ours a couple of times a week right now, just really keeping that immune system strong. And so I want to talk about where we can find, people could find this. Melissa and I don't know if you and I have been talking about touching our face, and I've never touched my face so much in one interview. I think you and I are like in a face touching vibe together or something. Definitely
I'll wash my hands.
Definitely gonna wash my hands after this. You guys have a YouTube channel. It's called HBOT USA, and if you guys are intrigued about hyperbaric, you guys are doing an amazing job with those videos, by the way.
Thank you.
Yeah, and I know you guys like to bring the science like I do, so that some of these tools can seem so like foreign and unusual, but like hyperbaric's been around forever and hasn't.
It's been around a long time, and there's just still, a lot of misinformation and misunderstanding around it. So, our goal with that is just to break it. Most of those videos are pretty short, and they're just like single topics, just so people can digest the pieces that they want, start to learn about it in like a, very user-friendly way. That's all.
Yeah. We basically just usually kind of pull, we'll look in like news feeds or, what are people dealing with, what's going on. And if there's anything that hyperbaric can help with or adjust, we want to bring it up. And that's usually what we try to do with the videos. One of the big things that's coming up right now over by us, I don't know if you're seeing it too, but a lot of people are asking about, can I take anti-inflammatories? We don't usually talk about them a lot in our practice, but, there's some information out there, don't take anti-inflammatories. This virus could be way worse for someone that has those in their system. And so we're getting questions about that because there's a lot of people, that have arthritic conditions or in pain or, tend to take those on the regular, and they're scared to, and they're wanting these, natural anti-inflammatories, and HBOT is so powerful for that. So we're gonna probably address that soon as well on a video, because we're seeing a lot of that. So just my point being, whatever we're seeing in the media or things coming up, if there's anything that HBOT can address with that. So obviously right now with this virus, we're doing a lot of content.
Yeah. And I did a video on what causes somebody to be immune compromised. And I think what scares me the most about what's going on right now is that we've got a population of people that are immune compromised and they don't even know it. And so when you've got a chronic inflammatory situation, you're taking anti-inflammatories and you've been doing that for months, years, you're immune compromised. So it's time to figure out some new tools. So and I love your guys' channel is awesome. So I really encourage people to go check you out. How do people find a chamber? That's the other difficult thing is, we have people watching this from all over the world. How do you find that?
So, there's ways of like trying to look up to see if there's clinics near you. We help people find clinics near them if they want to contact us. The IHA, International Hyperbaric Association, or HMI, Hyperbaric Medical International. They're both nonprofit organizations that have listings of clinics. So, and you could search by zip code, that kind of thing. You can get home chambers and you can rent them, you can buy them, and you can have, home therapy, which again, there's just differences between what you can or cannot do at home and what you can or cannot do in a clinic. So again, just matching the right tool to the right person and condition. But those are all options, and we're happy. That's a big part of our thing. We're just happy to help people identify how to get their hands on it, if it's even appropriate. And
a patient of mine rented one of yours. We've been detoxing her, and she was post-surgical. And she came out of her surgery with numbness in her arms. It was a explant surgery, breast explant. And that was the thing. The oxygen. I mean, I told her, I was like, you got to get this and really get in there. And I spoke with her a couple of weeks ago. She's doing incredibly well. The numbness in her forearm she's not numb anymore. She has full range of motion of her shoulder.
Great.
And it was all hyperbaric. So thank you for that.
It's that powerful nutrient. And I know what do you call yours? Your Benjamin Button.
Oh yeah, I call mine the So I call mine the Benjamin Button machine, because I tell you, every time I come out of there, I feel like I'm like reversing an age. So I know that everybody's thinking about immunity right now, but there is a whole longevity. I feel like my thoughts are clearer, my moods are better, my workouts are stronger, the joint mobility I'm having. And I've got my 84-year-old dad in it every week.
Oh, that's great.
Yeah, and he's so funny. We were somewhere and he was walking up the steps and he's like, "Hey, Mindy, look I can take 2 steps at a time." And he's like showing me how he can move. And then the other thing we did is we just got a PEMF machine. So he's going in there and then he's getting out and doing PEMF on his chest. And he had this mucus in his chest for over a year. And I was really concerned about him with this virus. Sure. And I'm like, you need to get an oxygen, you need to do PEMF. So he's done about 4 of the combination of those 2. And right. I saw him yesterday. He's like, it's totally cleared up. And he goes, you know what? The doctors told me that I'd have to live this with this forever. But after combining those 2, it's totally clear.
Love it. Especially right now too, in a time when there's so much fear. Right. You know, he has such a sense of control. I would imagine he's got a bigger sense of control now. I can do this, and it's going to give me, a greater edge. So that's so good.
Absolutely. So, okay, let's dive into some of our other biohacks. So I am with you guys on the hyperbaric love. I just adore that. But what else? We both use some other things in our clinic that are kind of cool.
Yeah, I like the light, right? Yeah. I love the combo of oxygen and light for me are my favorite tools. I actually read something recently, and I can share the article with you, Mindy, in case you want to share it. But it was, this presentation, this article on open air hospitals and how they were effective on pandemics. And so the magic was fresh air and light, right? And so, what I'm doing now is I'm taking advantage of the time that I have and trying to access more natural red light, right? Sunrise, sunset, because in the busyness of life, it's just tricky. And so the therapeutic light is so nice because super effective tool, amazing for boosting your immune system. Don't know how many people realistically get out for that red light exposure, right. Sunrise and sunset, especially with like limited clothes on, especially in New Jersey, right. Maybe out there in California, you guys can.
A little more, but not so much.
Yeah. So we love the red light. I know you've got the red light in there. Yeah. What's your favorite?
I think when we look at this stuff, to me, it's in so many ways we're replicating what we were supposed to just get in the first place, Right. So it seems, to some extent, it seems like silly to me because it's like oxygen. Well, we should have just gone outside, and red light. Well, we should just get some sunlight, and PEMF. Well, we should just ground ourselves more often outside. And we're supposed to eat, but the reality is our life is our life. And so, for many of us, like Melissa was saying, it's just hard to do that. Yeah. But, my focus to me is, as goes the health of one of our cells, goes the health of our whole body. Yeah. So, I look at that from just like a cell biology standpoint, and, the nourishment we're putting into our cells. So what are we putting in our mouth? Because the only reason we eat is so that nutrients can get to that cell. Yep. So what are we putting in our mouth, and what sort of, macronutrients, what's the fuel source that we're putting in? Because that makes a huge difference. Yep. So proper nutrition affects that cell. Light affects that cell. Electricity, we have a whole system of, our body using minerals to balance the electricity of every single cell in our body. It works so hard to do that. So PEMF, using electric pulse, using signals to rebalance the electrical field that we're supposed to have. Adding red light to move electrons and make energy, adding the oxygen to move those electrons and make that energy. What you do when you really look at what, like your resetter room, what you're really doing in there is between, what I know that you're, the equipment that you're using and the advice that you give with, keto and fasting and all those pieces, detox. we're eliminating barriers of normal function.
Mm-hmm.
And then we're re-putting in all of these ingredients that the cell just needs. And when you do one, it's amazing. And when you do two, it's fabulous. But each one you add isn't addition, it's multiplication, it's exponential. And so when you really hit the cell from 4, 5, 6 different ways, the transformations that people go through it's just an amazing process to watch.
That's so well said, because I think as a culture, we've been taught one problem, one pill. And that's where we sit right now, right? So we have a problem, but where's the pill? We don't have a pill.
Oh, we're locked in our homes waiting for it.
Right, I know, we're locked in, and I feel like I'm in the twilight zone in the last couple of weeks. Because I'm like, the pill's not coming. So
so we get out and do stuff.
So we're like maimed because the pill's not coming. But we have, if we could everybody just pause and realize, okay, wait, that form of healthcare may be why this virus has been able to spread across the world as quickly as it has, that we need to change the paradigm in which we look at health. So I love that idea that each one of these tools isn't like 1 + 1 = 2, it's a multiplying effect. That's brilliant.
Yeah, I mean, listen, if you look at, this is a little off topic maybe, but if you look at the health care industry that we all function in right now, that's really, for each of our issues, it's like, well, whatever you're choosing to do in your life doesn't really matter as long as you take this pill, right? Like exactly what you're saying. So we've become, the reason that we're all so scared by this is that we've become so reliant on that system to save us that we haven't done anything in the last week, month, year, decade to take care of ourselves. And if ultimately we were doing all the things that we needed to do the whole time to take care of ourselves, we see it. This virus is a perfect example. Young, healthy people are basically doing fine, right? And immune compromised and older folks who are immune compromised are not doing as well. And the reason for that is how our body adapts to environment. And so if you keep yourself stronger, healthier, and more adaptable by doing all the things that our body requires us to do, and not be passive, but be an active participant in that whole healthcare system, then we don't have to worry. Like, we have so many viruses. We have, what do we have? 7 trillion cells. We have 10 times more of that in bacteria. And I think we have like 7 times more than that in viruses living in our body right now. The issue isn't each infection. The issue is how our body deals with the host. Totally.
I told you guys I interviewed Dr. Zach Bush on Friday, and he said something that really had my brain thinking differently. He said one of the reasons we're seeing these viruses come out now is because we have been killing all the other bacteria. We've been killing good and bad bacteria. We've been trying to kill pathogens, and that viruses are at the bottom of the hierarchy. And so they're now emerging because we've, as he put it, we killed all their friends. We killed everybody else inside. And so the only thing left is the virus. So, there's that saying, you can't kill your way to good health. That it's like, we've got to go back and put the good bacteria in there. Things like hyperbaric, I loved what you said about how it can help the positive bacteria in our gut. It's like, we have to come at this from a different angle, because the angle we're at, it's not working.
Absolutely.
So, well, this was awesome. I know you and I, the three of us could sit and talk about this for hours. But where can people find you? Where's the best place? I know you have a clinic in New Jersey. So if you're, in that area too, tell us how they can find you.
Yeah, I would say probably the best part for your audience. I know your audience is really educated and loves information. So I would direct them to our YouTube channel. So it's HBOT USA, HBOT USA. If people have questions about getting home units, they can email Jason. So I don't know if you want to link his email below.
Yeah, we'll put his link in the comments. Yeah.
Perfect. Yeah, I would say those two would be the best.
Okay. Awesome. Well, thank you guys. I think they're I've already touched it like 10 times. I'm going to go have to.
We watched before, we'll watch after. It's okay.
But there, you know, there's two forms of healthcare right now. There's the people that are in the hospitals handling this, and you know, God bless them, and they are really,
Yes, thank
you
God.
know, warriors at this moment. And then there are people who are trying to prevent people from getting in the hospitals,
Absolutely.
and I put you guys in that category. So thank you for doing
You as
everything
well.
that
Thank
you're
you.
doing.
Thanks.
Yeah,
Yes,
thanks.
Mindy. So
Thanks.
good to see you.
Okay, have an awesome day.
Take care. You too.
Uh-huh.